Hello, my name is Harsha George. This is session 2 of the Acceptance and Commitment Therapy series that I began to share last week. The purpose of this presentation is just to share my knowledge of the ACT model, although very limited as I have no formal training in ACT. I am also so grateful and humbled by Dr. Russ Harris's graciousness in sharing free resources on his websites, thehappiness.trap.com and the actmindfully.com, that have been so handy in my practice as a psychologist. In this session, I'm going to present how other behavior therapy models can be incorporated into ACT. So basically, I am going to focus on ABA and RFT. So what are the principles of behaviorism that ACT incorporates from ABA and RFT? One of the most powerful tools in ABA is functional behavioral analysis. Simple ABC formula to help us do this is antecedent, behavior, and consequence. Let's say the antecedents are feelings of anxiety and sadness, thoughts such as I'm a loser, environmental factors including a TV, a fridge full of beer, and being alone. Some of the behaviors might be watching TV and drinking large quantities of beer until falling asleep intoxicated. The consequences in the short term might be relief from painful thoughts and feelings, and in the long term, damages to physical health and increase in emotional pain. So, how can ABA be incorporated in ACT? Respond differently to the antecedent thoughts and feelings using diffusion and acceptance. I shall explain these concepts in a following session on techniques. Remove an environmental antecedent. Make sure there is no beer in the house. Focus on the consequences, or in ACT, what specifically is called workability. In the short term, getting drunk makes you feel a bit better. But in the long run, does it work to enhance and enrich your life? Does it take your life in the direction you want? Explore and clarify the client's values. Explore values, consistent activities to do in his evenings. Clients' values will now become antecedents for behavior that has life-enhancing consequences. Ideally, the client will be rewarded by the positive consequences of his new behavior, increase the occurrence of new behavior in the future. What about RFT? Human behavior of deriving relations between events, joining them into vast relational networks, and transferring functions between related events is known as relational framing. The words my life are part of a gigantic relational network related to countless number of events, including all sorts of thoughts, feelings, and memories about everything from my job and my social life to my health and to my family. If I relate the words awful and pointless to the words my life, the functions of awful and pointless will transfer to every event within that vast relational network. Everything in my life will seem pointless and awful. RFT, or relational frame theory, explains why cognitive fusion and experiential avoidance are both harmful. And ACT targets these processes. So our ACT targets cognitive fusion and experiential avoidance. Theoretically, ACT is rigorously behavioral, yet is based on a comprehensive empirical analysis of human cognition. ACT and other behavior therapy models. Acceptance inherently involves exposure, and thus ACT connects with all the exposure-based behavior therapies, but not for an emotional regulatory purpose. ACT relies heavily on paradox, metaphors, stories, exercises, behavioral tasks, and experiential processes, while logical analysis has a relatively limited role. Limitations of ACT. There is a heavy reliance on language and metaphors. ACT may not be suitable for everyone because it requires a high level of self-awareness and introspection, which can be challenging for individuals with severe cognitive impairments or limited insight into their emotional experiences. ACT focuses more on what clients can do in the present and so may not be comprehensive enough to meet the needs of people with deeply rooted trauma. As I said before, these resources are all available on the happinnesstrap.com and the actmindfully.com.au website. So I shall stop here for this session on the ACT series.